Okay, once again, good afternoon. My name is Leanne Foster, and I am part of the Provider Outreach and Education team here at WPS. And I want to welcome everybody today, and I hope you are doing well. I want to welcome you to our Provider Enrollment Basics session today. This is going to be a basic overview of what provider enrollment is, what the basic function of it is. There's going to be some tips and tricks. We do have other education that offers a deeper dive into some other facets of provider enrollment, and we'll talk about those today. But today, a little bit more, but today our objective is to provide you with a basic understanding of the provider enrollment process, and this is going to include the applications and how to avoid delays when you're submitting your application. So to accomplish that today, we are going to do an talk through an overview and explain the purpose of the provider enrollment process. We're also going to talk about submission methods, and there are a couple of ways that you can do that, both electronically and on paper. But we also want to go through each of the forms at a high level to help you determine which form best suits the enrollment action that you're trying to take. We're also going to talk through some common application scenarios and what you can do through the enrollment applications. And then I'm also going to give you some tips and resources. And these tips are going to highlight some of the areas that we're typically finding we need to develop for additional information so that you can avoid that in the future. Our ultimate goal is to help you submit an enrollment application clean with no development the first time, because we can process those applications quite quickly once we have all of that information. So I'm going to start with a provider enrollment overview. Now, if you've attended any of my sessions where I'm talking about provider enrollment, you've heard me say this before. Provider enrollment is really the first step in the claims process, because with Medicare, if you are not enrolled, you are not able to send a claim and have that adjudicate through our system. So you do have to go through the enrollment process in order to start your path to submitting those claims. Provider enrollment is also uh, a large fraud and abuse prevention tool for CMS. Medicare claims are paid out of the Medicare Trust Fund, and the best way to protect that Medicare Trust Fund is to keep those that would do that trust fund harm from gaining access to it in the first place. So provider enrollment is really kind of the gatekeeper to accessing those funds. And so throughout that process, we're verifying a lot of things. A lot of it has to do with provider qualifications. So we're making sure that providers are licensed within the requirements CMS has set for a particular provider or organization type. We're making sure that if there are any certifications besides that licensure that are required, that they're maintained and that they are active, that there are no, for both licensure and certifications, that there are no disciplinary actions in existence. We're also verifying address information, particularly with claims for groups, for organizations and the members. We are going to be asking the providers to report where those services were provided. And the addresses on those claims do need to be on the provider's enrollment record file, or claims could be rejected or denied. We will not process a claim for a practice location that we don't already know about and have not vetted as being in existence and appropriate. Also, enrollment handles all of the bank account information. Medicare makes all of their payments electronically through an electronic funds transfer process, and part of enrollment's role is to obtain that information, to get that to our financial area, to set up those connections so that when you send your first claim, the the payment and the reimbursement go to the appropriate accounts. We're also doing some other things for CMS. We do confirm whether or not a provider has paid an enrollment fee. Now, we will talk about this a little bit, but some providers, and it's going to be your organizational providers, so think facilities, hospitals, ambulance service, labs. There are instances where they need to pay an enrollment fee. There are some site visits, which I'm going to talk about as well, site visits that need to occur with certain provider types, and this fee helps offset some of that. So next, let's talk a little bit about who can enroll. So Not everybody that is a healthcare practitioner is necessarily eligible for enrolling in the Medicare program. Many of them are, but there are some exceptions. So first and foremost, you have to be a provider that's going to bill Medicare. Okay, so if you are billing for Medicare services and you are billing traditional Medicare, you are required to enroll in Medicare and get what we call a PTAN. That's a provider transaction access number. And you're going to bill with your MPI, which is your National Provider Identifier. But that PTAN is really what connects your practice specific or business specific information to that MPI because providers can have multiple. And we'll talk about that a little bit later. Also, providers that are not going to bill Medicare, but they are going to order and refer for services that Medicare enrolled providers will bill. So examples include maybe you are a provider at a VA hospital. Not all VA hospitals can provide all of their services. They may have to refer a patient outside of the hospital. Say maybe they don't have MRI equipment. They'll refer a Medicare eligible provider to a facility that is covered by Medicare but not part of the VA. The provider that refers them needs to have their MPI on a claim in order for that MRI to pay. You can't just walk into an MRI and say, I want an MRI facility and say, I want an MRI today. When that comes through, Medicare is looking for that. So that referring provider is not going to bill for the service, but they are going to represent the referral for that service. So they won't get a PTAN in that case, but their MPI will be on file as someone who will be ordering and referring for services that will be billed to Medicare. Also, individuals. So eligible physicians, non-physicians, it can be facilities as well. So physicians, your MDs, your DOs, your non-physicians, it's not every non-physician. We're going to take you out to where you can find that listing, but non-physicians, we're talking about nurse practitioners, physician assistants, social workers, psychologists, nurse midwives. Those are the types of non-physicians that can enroll. Facilities, we're talking about our hospitals, could be a federally qualified health center, it could be a clinical lab, could be an ambulance service. Those are going to fall under the facilities and suppliers that can enroll. And this can get a little bit confusing. Is there a list? And that's one of the questions that we did receive. And the answer is there is a list of the providers who can and cannot enroll. It is in the CFR, and I have included that as well. But there's another place that I want to show you, and it is the Program Integrity Manual, specifically Chapter 10. So I'm going to go out to the CMS website. And from here, there's a couple of ways that you can find it. The easiest way is probably just to scroll down and look under manuals, forms, and transmittals. You could search for Chapter 10. You could go under Medicare and go to regulations and guidance, but I'm looking for the quickest, fewest clicks. So I'm under manuals, forms, and transmittals. And I'm going to go to the internet only manuals. These are the manuals that govern everything that we do in Medicare, and provider enrollment is no exception. So you're going to go to 100-8. This is what we call the Program Integrity Manual. You'll hear me refer to it as the PIM. And once we're in the PIM, there are a multitude of chapters. From here, you're looking at Chapter 10, Medicare Enrollment. So this is the manual that oversees all things enrollment. And I saw from the registration questions that I do have some people on the call today that are newer to the enrollment process. This is going to be your manual that is probably going to answer most, if not all, of your provider enrollment questions in a manual format. This outlines everything that providers are required to do, but it also outlines the responsibilities of the MAC in the provider enrollment process outside of internal administration process, which we have say over. But here it will talk through what provider enrollment is. It'll talk about the process. Our timelines are laid out in here, along with requirements for applications and providers that can enroll. So here's how you're going to know if you can enroll or not. First, it is divvied up by form. Here we're looking at the 855A. And here are the types of facilities that are typically enrolled under that CMS 855A. I'm going to go to individual practitioners. So here's the list of individual practitioners who can enroll using that 855I, and we'll talk about these forms in a minute. That I is for individual, but it runs through the different non-physician specialties that can enroll. Now, usually the browser is playing nice and the manuals have jump links, and they do today. I'm going to go to nurse practitioners. So if you need to enroll a nurse practitioner, you can jump to that section, and it's going to lay out for you what we're looking for in terms of licensure and certification. These are going to be the requirements that that individual non-physician would need to meet in order to enroll in the Medicare program. So there are no surprises. If you're not sure, if you need something in writing, this is where you want to look. I'm going to also go to, pardon the scrolling, there is a listing in here of providers that are not eligible to enroll. One moment. And give me 1 second. I'm going to go ahead and search. This is also, oops, ineligible. One moment, please. There it is. All right, so you are going to see that this is completely searchable, okay? And it is going to be something that's going to allow you to see it. And give me 1 second, I'm looking for my section. They did some readjustments in here, and I apologize. Here you'll see the processing duties. Ooh, they may have just removed that. I apologize for that. Yep, they did. They removed that. I apologize for that. That's a recent change. They removed the list of providers ineligible to enroll, which is why I'm not finding it. So, but here you do still see the list of the providers that are eligible to enroll in the Medicare program along with their requirements. So that's going to be a very valuable resource to you as you are going through that provider enrollment process. And it is a living, breathing document, so you will see changes, removals you will not see. But if there's any recent changes, you will see it in red text. So once you know whether or not you're eligible to enroll in the Medicare program, then it comes down to what enrollment actions can be taken during that enrollment process. So there's a couple of different actions. There's an initial enrollment. Now, initial enrollment can mean a couple of different things. It can be that it is a provider or a facility that is new to the Medicare program, which means it is not enrolled in any jurisdictional state. They do not have a provider transaction access number. That can happen simply because that facility's maybe been in business for years. Maybe they're a new facility, but if they're an existing facility, they've maybe just not seen a Medicare patient until this time. So it's not uncommon for individuals or organizations to be practicing and then all of a sudden needing to now enter the Medicare realm and billing those. The other thing that can happen is jurisdictional state. So WPS is the MAC for jurisdictions 5 and 8, and all MACs have multiple states. Now, just because you have a MAC that, say, for instance, we process claims for both Michigan and Indiana, a provider is enrolled in Michigan, now they also want to enroll in Indiana. They do actually have to enroll separately in Indiana. And it has a lot to do with how our claims adjudication system is set up and how things price. Things are priced based off of, in the Part B side, based off of practice location, that geographic location. And so payment may be different, and we cannot commingle those states. So you may be an established Medicare provider, but you're now going to a new jurisdictional state, either with the same MAC or with a different MAC. That is considered an initial enrollment. Also, you can change existing enrollment data. This is really critical. You want to make sure that you're keeping your enrollment data up to date, making sure that if there's any changes in address, changes in name, changes in specialty, you're not letting that fall by the wayside. That is something that needs to be kept up to date. Not making changes timely is something that can cause claims denials or delays. Also, revalidation. When a provider enrolls, every 5 years, they are asked to revalidate their record. This is something that is completed similar to an initial enrollment, but it's re-verifying all of the information that we currently have on file for them. We do have separate webinars that go deeper into that revalidation process, along with the changes, but we're not going to cover those in great detail today. Also, deactivation. This is something that if a provider retires or leaves a practice or is no longer seeing Medicare patients, it's important for them to deactivate their PTAN numbers. That prevents fraud and abuse on that PTAN number. If somebody who shouldn't have access to it gains access to that. It's much like if you have a credit card that goes dormant, it's deactivated. That is very similar to what we're talking about here. We just want to make sure that active claims can't be submitted if you're no longer in need of that number. So once you know what your action is, you know that your provider can enroll, this is what the process looks like. So first, before you even submit an application, the provider does need to obtain their NPI, which is the National Provider Identifier. This is a 10-digit identifier, and it is not assigned through the MACs. It is assigned through a national contractor, which is the National Plan and Provider Enumeration System. It's an automated system. It's very quick. It's pretty simple. You do it online. I have heard from providers where they're getting their NPIs in less than an hour. You provide some base information and some licensure information. Now, that is just to get that number. Getting that 10-digit number does not mean that you are set up to enroll in Medicare. NPI is a national provider identifier. It is used by multiple payers. It's used by all payers. It's meant to simplify the billing process for the providers. You have an NPI. We assign PTANs. Those PTANs are what connect specific practice specific data to your NPI so that the claims adjudicate properly. So you need to have that NPI. If you don't have it and you submit an application, this is one of the pitfalls. The very first thing that we'll do is we will develop asking you to get that and get that on the application so that we can process. The provider, once they have that, will submit that application. There's two methods, and we'll talk about them here in a minute. You can do so electronically through our provider enrollment chain and ownership system, also known as PACOS, or you can submit through a paper CMS 855 application. We'll talk about those a little bit more in a second. Once we have everything and everything verifies, we'll make an enrollment decision. If it is an approval decision, then a PTAN is assigned. A PTAN being assigned means that the provider meets all eligibility requirements, and at that point, you are ready to bill. Your record is built into our claims adjudication system for claims processing. So submitting an application. Two options here, as I mentioned. You can do it electronically through PACOS, or you can do it via paper. PACOS is the only electronic submission method that CMS has. Um, you cannot fax or email an enrollment application. If you want to submit it electronically, it does need to come through PACOS. Now, PACOS does require a user ID and password. Now, that user ID and password is not something that's managed by the MACs. It's not managed by PACOS. It's managed by something called the Identity and Access Management System. And in a few minutes, I'm going to ask Aline to throw a couple links in the chat. We do have a webinar that we recently did called Getting Started with PACOS, and that walks you through how to set up your user ID and access, including setting up surrogates and connections in order to submit applications on behalf of a provider. That INA management system manages the user IDs for MPES, PACOS, and a system known as Pepper. Those are all three CMS systems, and they all have the same user ID and access. Once you have registered, then you will access PACOS. We did also get a few pre-submitted questions for step-by-step instructions of submitting an application in PACOS. That is also its own session, and that is going to be the Encore PACOS Basics that we just did. That'll actually walk you through getting started inside of that enrollment system and actually starting some basic application types. So if you're interested in submitting electronically, maybe you're not doing so already, I encourage you to take a look at those. Paycos by far, though, has the fastest processing time. And this is because you are, as the provider, entering all of the information into a system that has automations in it for verification and data entry. In fact, CMS does set the processing time for any electronic submission that does not require development, which means we have everything that we need. We do need to have that processed within 15 calendar days, and we are typically at or below that. Um, there's less chance of you forgetting something. Paycos works kind of like a do-it-yourself tax software where it asks you questions about your situation and it customizes the application and it requires the sections that it knows you need based off of the PIM that we just looked at. It will ensure that you are at least providing us with that information. Now, there's room for typos. There are some things the system can't do while you're entering it, but you will never omit a section if you're submitting electronically. The other thing, once your claim has processed and you've submitted electronically, it's going to allow you 24/7 access to your current enrollment data. So at any point, you can sign into Paycos and you can see what locations do I have, what uh, bank account information do I have, what providers are reassigning benefits or what providers are working for your group or clinic. It allows you access to all of that. It's also easier to submit changes and revalidation applications in the future. There is a paper option, and this is going to be a paper application that is available on CMS's website, and I have included links. It's the 855A, B, I, and O, and we're going to go through each of those here in a minute. But once you identify the application, you will need to go out and complete it. It is a PDF template. From there, it will be printed and it has to be signed. Then it does have to be mailed. As I said, it cannot be faxed, it cannot be emailed, and these do typically have a longer processing time. An application that does not require any development, processing time is 30 calendar days. Again, we're typically at or below that. The longer processing time represents the time needed to take that application through our mailroom process, get that into our workload management system, and also uh, we do not have as many options for automated verification and entry. CMS and the MACs do prefer that applications come in electronically. It is more efficient for the provider. It is also more efficient for the MACs. The other kind of downside to the paper application is once you're enrolled, you will not have access to your current enrollment data. You have to have at least one electronic submission to be able to see that information. So you may have PACOS access and you're enrolled and wondering why you can't see your enrollment. If you've never submitted an electronic application, it's not connected yet. You'd have to submit an enrollment for that record in order to see that information. One question that we did get, and I want to address this here, was asking about whether or not enrollment and their documentation is included in the new initiative from CMS to stop using fax. So that initiative does call out claims related documentation, and that is it at this time. PE does already have an electronic method for providers to submit it and is to upload it with an electronic application. If you get development from provider enrollment on a paper application, they do provide a method to submit that electronically as well. So provider enrollment's really already gotten away from some of that fax. They'll give you a fax number, but that does go directly into our claim systems, or excuse me, our provider enrollment system. So provider enrollment already has that in place. As that evolves, if CMS is making additional changes that do impact provider enrollment, we will be communicating that through our listserv, our website, and future sessions. So once that application has been submitted, this is what happens to it. It has two paths it can go down. The first one I'm going to show you is the basics. So there's submission. It does get screened or reviewed to see if we have everything. And then the analysts need to make a decision. Do we have everything? They'll continue in the process and they'll make an enrollment decision, whether that's an approval or a denial. If they don't have everything, they will develop and that application will be placed on hold for up to 30 days. Just depends on if the provider responds. So that brings us to the other outcomes that can happen. So if a provider or an application is submitted, it's screened, development is required, a notification is sent to the provider, either by email or letter, depending on what information we have available to us. That will go and it will give the provider 30 calendar days to respond. If we get a response with a complete response within those 30 calendar days, we will make our enrollment decision. And typically it's an approval if we're making that enrollment decision. Approvals are by and large the larger of the enrollment decisions that are made. Although denials can happen, and that's typically because a provider doesn't meet the requirements for enrollment in Medicare. And there are instances where providers will submit to get that denial because they need that to process for private payers that would maybe cover that. So the other two outcomes, if we get an incomplete response and there is not any additional time left in those 30 days with which to work with the provider, if we get a partial response and say we get it on day 5, we will reach out to the provider and say, hey, we still need this, this, and this, send that in. So we will work with the providers in good faith because we'd much rather process these applications the first time than have them come back in. However, if that fails and we have a response but it's incomplete, we will reject that application, which means that it is closed out and the provider would need to start over. We will also reject an application if in those 30 days we hear nothing from the provider. So if we don't get any type of response, that application will be closed as a rejection and the provider would have to start over with the application process. So our goal here today is to help you get that through to the enrollment decision smoothly, hopefully avoiding the development, but with an understanding of what happens if we don't receive that information. So that's the process. Next, I want to talk about what each application does. We have 4 of them, and it's important that you know which form is appropriate for what you're trying to do. Now, all of them can facilitate an initial enrollment, a change, a revalidation, or a deactivation, but the forms are different based on the type of provider. PACOS will also bolt together different topics, as you can see here on this slide, based on what you told PACOS, the type of provider, to make sure that you get the appropriate questions and that the MAC obtains the appropriate information. So we'll start with the CMS 855B. Think of it as B is for business. This is going to be for any Part B providers, so anyone who is billing on a CMS 1500 form or an 837P transaction. It's going to be for any of those providers that are organizations, clinics, or suppliers. So if you have a group or a clinic with members, say you have a medical practice, ABC medical practice, and they have 15 physicians, non-physicians that work for them. This is your typical clinic. They're going to enroll the clinic itself through the 855B, but in order to set up a clinic, we need at least one provider that's reassigning benefits if they're telling us they're that group clinic setup. It's also used for suppliers and organizations. What we mean by that is going to be an ambulance supplier, a clinical lab, a mass immunization roster biller, an IDTF, which is an independent diagnostic testing facility. Most commonly, that's going to be things like MRIs. These are going out pharmacies, which would also kind of be a spinoff of the mass immunization roster biller, but they're going to be those organizations and suppliers that don't have individuals reassigning benefits. For instance, ambulance is a real good example of that. Medicare doesn't enroll paramedics or EMTs. They pay based on the ambulance service itself and not what the individual providers did. So they would submit an 855B, but they would not reassign benefits. With a reassignment, the individual is billing for performing the services, but we're paying their employer, we're not paying them directly. Again, this is going to be for those providers that are billing using that 1500 and that 837P. The next form is going to be these 855I, again, using that I to represent individuals. This is going to be for individuals that are going to be billing Medicare. They could be new to the Medicare program. They could be new to the jurisdictional state. They could be established providers that want to add a reassignment or add a new employer. It is not uncommon for healthcare providers to work for more than one clinic, and I have seen providers that work for one clinic. I have seen providers that work for, maybe they're on a rotation and they work for 30 different clinics. That is all acceptable, but they do need to add the reassignment for each one of those clinics that they'll be practicing under, because those clinics are going to be the ones that are going to contain the payment information. So they would use that 855I. They'll also use it to make any changes to their enrollment information. So if they need to change a contact, if they need to change a name, if there is an adverse legal action that they need to report, that's all done on the I. We also use the 855I for individual practitioners that are in what we call private practice, meaning they don't have an employer. This is going to be your smaller clinics or smaller offices that where there's maybe just one provider, and they are a sole proprietor under their unincorporated tax or their social security number only, or they are incorporated, they have a business, but they are the only owner of it. That's what we refer to as a sole owner. And in that instance, we would set up a clinic and them as the sole owner as a reassignment. But these are going to be providers that are separate from, say, a larger health system. Oftentimes, the names can vary, but oftentimes the provider's name is is the name of their practice. That's usually a big tip off, but that's what we're looking for there. Next, we have the 55A. This is going to be for my institutional facilities that are on the line. These are going to be for providers that are billing their services using the CMS UB04 or that 837I electronic transaction, so facility claims. You're going to be thinking about, it's going to be hospitals, critical access hospitals, federally qualified health clinics. It could be rural health centers. This is going to be just those overarching organizations. I want to say larger, but some of them can be quite rural and quite small. But these are going to be facilities, and it's typically, but not always, inpatient services. Rural health clinics might be offering outpatient services, but they're billing them on that UB04, their 837I transaction. So when you're determining which enrollment application, think about how you're going to bill. That's really going to steer you between an 855A and an 855B. Even though you are a facility or an organization, think about how you're going to bill. The last enrollment form that we'll talk about before we get into some supplemental forms and some other enrollment items will be the CMS 855O. The O is for ordering and referring. So these are providers, as I said at the beginning, they're not going to be billing Medicare for their services directly. Um, Again, that example could be someone who's working for the VA. That's an organization that's already being reimbursed by a federal program, and they're not going to be reimbursed from multiple federal programs for that same service. So they may be providing a service that doesn't, to a Medicare patient that also qualifies for VA. That service is going to be billed to the VA. It's not going to be billed to VA and Medicare in that instance, but perhaps that VA facility does not have all of the specialties or all of the equipment that's needed to treat that patient. The VA will refer that patient to a Medicare provider outside of the VA. They will bill that service to Medicare, but because it's a service that may require and ordering referring providers MPI on the claim. We do enroll them so that that MPI is in our system. So when claims adjudicate, it sees that and claims process appropriately for that Medicare service. No PTAN is going to be assigned. With the 855B, the I, and the a PTAN or some type of number, Medicare number, is assigned. And with an 855O, they just have their MPI because, again, they're not asking for reimbursement from Medicare. They're not eligible because the service that they're billing for is already being paid by another federal program. Pardon me, my screen just locked up there. There we go. Now, there are some forms beyond the CMS 855s that may be submitted for PACOs, for the electronic applications. They are actually typically part of that electronic, or there'll be a supporting document that PACOs will ask you to complete and upload. But they are the same whether you're talking about a paper application or an electronic. The first one is the CMS 460 participation agreement. And the title of this slide, if you have the training materials in front of you, the title is the link to that form. This is an optional form. So we often get questions about, I'm enrolled, but I'm not listed as participating. Something went wrong. Being enrolled in Medicare and participating in Medicare are two different things. Enrolled means that you have a PTAN and that you are billing for service. By filling out the CMS 460, you are also indicating to us that you are going to accept assignment on all Medicare claims. What that means is Medicare payment and their that's based off of their allowed amount is going to be payment and in full beyond deductibles and coinsurance. If you do not fill out this form, you are what's referred to as a non-participating provider. And you can bill the patient a little bit more than the deductible and the coinsurance, but you are subject to what's known as a 115% limiting charge. And that is 115% of Medicare's allowable. So this is an optional form, and we'll often get questions about, how do I know if I should fill it out? What I would recommend when you're trying to make that decision is to come out to our website. Oh, come out to our website and look at the fee schedules. I'm just going out to, it's a Part B fee schedule and it's for J5, but you want to look at the fee schedules. When you look at these, it will show you the par amount. This is the payment amount for a non-par provider. It'll show you the payment, or excuse me, for a par provider. It will also show you the payment amount for a non-participating provider, and then there's the limiting charge. That limiting charge is the most that a non-participating provider can bill that patient. If you're participating, you get paid a little bit more. We'll also advertise a little bit. The provider's information goes out on what's known as the compare. It goes out onto the Medicare.gov website so patients can find you. And also if there's Medigap insurance, we will cross that over. So this is optional. It is something to consider. It's not required. If you don't submit it, you will be asked if it was an omission or if it was your intent to enroll as non-participating. However you respond will dictate how we move forward. If you say you want to be non-participating, that conversation is over. If you say you meant to be participating, there will be a request for this form. It's only asked for individuals that are in private practice, so those sole owners, those sole proprietors, and then groups, suppliers, and organizations. This also does not apply to Part A providers. So if you're filling out that 855A and you're billing on that 837I or that UB, this is not a concept that applies because our Part A providers have a different payment methodology. This is a Part B concept. It's also not something that is asked of individuals that are reassigning benefits to an employer because their employer has to make the decision, and you will have providers that work for both participating and non-participating groups. So it's all driven off of the entity that is actually receiving payment. versus necessarily just the enrolling provider. So speaking of payment, the next form, and this is something that is required in PACOS, this is required of our individuals that are not reassigning benefits and all of our facilities and our suppliers, our organizations, group clinics. It is how we set up electronic deposit for all Medicare payments. It does have to come in anytime there's a new enrollment or if there's account information changes. So if the bank account changes, if the routing number changes, that all needs to be reported to make sure that the funds are moving smoothly. Providers are required to receive their payments electronically. Medicare does not issue paper checks. And then along with this form that asks for bank information, account information, it'll ask for contact information to make sure that we're setting this up correctly. We are going to be looking for account information verification through documentation. And that documentation is most commonly a voided check. For newer accounts, it can be a signed letter from the financial institution. It needs to contain the routing information, the account information, the name, and the type of account, and it does need to be signed. It can be a teller, it can be a president of a branch, but it does need to be documentation saying that yes, this is a valid account, this is where the money needs to go. Couple of things to keep in mind: starter checks, anything where you're handwriting things, that does not qualify as verification because it's got to be something from the bank, printed up or signed by the bank, confirming that information to make sure we're sending it to the appropriate place. The other question that we get is if an entity is just setting up, it's a new account, does the check number count? Like is check 100 worse or invalid for documentation where we need check number 1000? That check number doesn't matter. It's all about the account information, whether it's a starter check or not. There is other supporting documentation that could be required for your application. If you're submitting electronically, it is going to give you a list of what we're looking for, required versus optional, that may need to be provided based on what you told it. In a paper application, the application will tell you as you go what documentation is required. Typically, we're looking for copies of license and certifications. Some of this we can verify through third-party sources directly with the licensure certification body. There are some certification and some licensure bodies we cannot contact directly. We will make every effort to verify this information independently without bothering the provider, but if we can't, we have to ask for a copy of it. Education, we make every effort to confirm what requirements the licensure has. If it meets CMS requirements, we may not ask, but we're looking for diplomas if we do ask for education. There are some provider types, nurse practitioner is a really good example. They're required to hold at least a master's level in nursing in order to enroll, and the diploma has that printed on it, and we don't have another way to verify that. So if you get requests for this information on some providers versus others, it's because we're making an effort to verify it on our own. If we can't, then we need a copy. Not originals, copies. They do not need to be notarized, but we may need copies of it. We do need IRS tax identification number information. So these would be things like the CP 575, a 501c3 if it's a nonprofit, but these will be those notification letters printed out by the IRS that has the legal name and the tax ID associated with it. We use this to verify that our records match the IRS, and if they don't, it can cause delays. Bank account information, we just talked about that. Organizational structures, if there is an organization that has parent companies, we do look for org charts or organizational diagrams that show the ownership to make sure that all entities are represented on the application. This is not an all-inclusive list. However, on our website, under our topic center, you will see an option for provider enrollment. And there's a couple of ways to do it, but documentation is one of the categories. So if you look at documentation, you will see provider enrollment documentation as a resource, and this is included in the resource section of your material today, but it will show you based on the provider supplier type, the type of documentation that we are going to potentially need so that you can tell by specialty. So you have that information. This is a very useful resource. In fact, I'm going to throw that into the chat for you if you'd like to take a look at that. So at the beginning, I did also mention enrollment fees and site visits. Some providers are required to pay an enrollment fee, and some are required to have site visits. It is based on what the application is trying to accomplish and the type of provider. I have included a couple of links here. The first one is this chart. I know it's super small, but that first link, that application requirements for institutional providers, does take you out to CMS's chart that tells you for this provider type, yes or no answers for a particular application type, whether or not that fee is required. We have also created an enrollment fee decision tree. I'm going to go back out to our website. And this one I'm going to search just to show you a couple of different ways of accessing information. And you'll see here it comes up. I'm just going to hit enter so you can see the greater list. So here's that decision tree. This will take you through a series of questions. Just going to answer it. And then it's going to ask you the type of provider that you are. And I'm going to say I'm doing an initial here. And it will tell you whether or not that enrollment fee is required. And then it'll give you additional information for how to actually pay that enrollment fee prior to submitting that application. If it is not paid prior to submitting the application, it will be developed for in the process. The 2026 fee is $750. That's per application. So my recommendation, if you're a provider that requires that and you're adding a bunch of addresses, try and add them in one application. It's not based on number of addresses. It's based on per application. And then there is a link there for fee payment. We also have one other decision tree that walks you through determining if you're still not sure what your application or your provider is trying to do. We do have a decision tree out there for application guidance. And I'll take you back out to our website. And I'm going to go back to the Provider Enrollment Topic Center. There are other method. You can actually just do an A to Z list, and then everything's in alphabetical order. Again, just showing you the different options that you have to find this information, but there is a provider enrollment decision tree that works much like that enrollment fee that gives you links to helpful resources as you go through your enrollment process. Do you have an MPI? It'll ask. It'll ask if you're for one of our jurisdictional states. And then it'll ask you, what are you trying to enroll as? And it'll give you references to the chapter. And as you go on, it'll tell you which application you need to submit. This works for paper and electronic applications because the application would be the same, but it'll let you know which, what needs to be submitted. So you've determined what you need to submit. You have submitted it. What's next? You can check your status in PACOS. We do also have an enrollment application status inquiry screen, which I have included a link for in your resources section today. So you do have that, but it will allow you to check for that. Once we have everything that we need, we will send a notification letter by email if you give us an email in the contact section. If you don't, it will go out physically. It will look like a letter, and it will have your MPI and your P10 and the provider name on it. But once you receive that letter, you are ready to bill. That letter goes out once we have confirmed your information is set up in our claims adjudication systems. One caveat, PACOS is usually, if you submit electronically, we'll send out that notification about 24 to 48 hours before that information is actually gone to our claim system. PACOS drives that system, so wait until you see the email from um, Medicare provider enrollment, and again, it will look like a letter versus just the PACOS. At that point, you are set to bill. So as I said, here are some resources. We've talked about most of these today, but you do have that information out there for you. For the sake of time, I do want to jump into questions. I have a couple of pre-submitted or one pre-submitted question that I have not addressed yet, and then I'll check in with Aline to see what we have. One question that we got was whether or not you could request to be a provider authorized official or AO from both websites, meaning that Identity and Access and PACOS. The answer is yes, but they use them a little bit different. The Identity and Access does require an authorized official to be on file because they're also going to be the administrator for any surrogates or connections. However, Identity and Access does not update the enrollment system. Remember, our Identity and Access Management System is user ID and password only for multiple CMS systems. If the individual needs to be an authorized official for Medicare applications, they need to also be added to PACOS through an application. PACOS and INA do not talk, and that is intentional. They don't update each other. So also conversely, if you do have an authorized official that you updated in PACOS, that's not going to change it in the INA system. They are independent systems. All right, so with that, we have just a couple of minutes. Aline, do we have any questions in the chat?
Hi, Leanne. Thanks. We did get a question from Denise, and it's actually in two parts. So the first part, if we are moving offices, adding a new office, what form will we need to complete to add the new address to our group?
Fantastic question. You indicated that it is a group, so that's telling me you're a clinic that has members. If I'm wrong, please throw clarification in the chat for me. But if it is for a group, you are going to submit an 855B, either electronically or on paper, and you only have to fill out a few sections. We need some identifying information. We need the new address information, and we'll need a signature and some contact information. But it will be that 855B. Now, when we change that on the group, any group members that are enrolled within that group will be eligible to go to that address. You do not need to submit separate applications for the members because that group is actually, think of it as a parent-child relationship. That group is the parent, and all of the children need to follow suit with that parent. Now, one caveat with it, you are going to, and I think I might have, Elaine, I'll check in with you in a minute. I might have jumped into the second part. I just see that now. But one thing you will want to do if you are moving or adding, when you fill it out, make sure you are end dating the address that you're leaving and adding the new. So you'll need to report both addresses. And here's the reason. The address that you're leaving is still eligible for claims processing within the timely filing period, which is 1 year. And we do not delete addresses off of files. We end date them so that for the next year, if any claims come through for that address, you still have it even though you're not there. And then claims will start paying based on the effective date of the new address. All right.
Thanks, Leanne.
Oh, go ahead.
You did actually address the second part of that question, so thank you. We got one more. Do we have time, or do you want to hold it?
Let's go ahead.
All right. This comes in from Tina. She says she's in a state-owned psychiatric hospital. They will be moving and changing their name. How soon should they submit the application?
I would generally submit that as soon as you know. However, there is a limitation. Typically, we will not accept changes that occur farther than 90 days in advance, and that's because things could change. If you're within that 90-day time frame, I would go ahead and submit that. They will put an effective date on that name change and they will process it accordingly. But the sooner the better. Ultimately, our goal is to have that in place on the date that you have that name changed. So the other question with that would be, is there a tax ID change? If it's just the name change and it's maintaining the same tax ID, that is simpler. If that tax ID is changing, it's likely going to result in new PTANs needing to be issued. So that is just a little bit of extra information for you to consider as you're submitting that change. With that, we are running close on time. I do see that one more question came in. I will send an email response to that. So we'll make sure that you do get an answer to that, but I want to be respectful of everybody's time. If you have any other questions that you think of as we're signing off this session, you will have the opportunity to send those in for the next 7 days. And Aline's just put that education mailbox in the chat again for you. You can go ahead and send your questions there just in the subject line. Make sure that you have provider enrollment basics, something that lets them know it's related to this webinar so that they get those, my teammates that are watching that, get that question to me so I can get you a response. In a couple of minutes, you are going to receive an email that is thanking you for attending. Don't delete that without reading that. There's a couple of things. One, if you're attending for continuing education credits today, this is your certificate of achievement that can be submitted to your certification or accreditation body to count towards CEUs. We don't issue those CEUs, but our contact hours do count. So make sure that you're taking a look at that. If you didn't get it, one of two things happened. You attended by phone, and I don't have a systematic way to verify your attendance, or it went to your junk or spam folder because our WebEx Messenger sender from our software is not in your safe sender list. Either way, you're fine. Send me an email to that same mailbox. Let me know that you attended today, you need a certificate, and what phone number you attended from. As soon as I confirm your attendance, I'll get a certificate out to you. The other thing in this email is going to be that survey that I mentioned before. As I said earlier, we want to make sure that we are giving you the best possible support as you navigate the Medicare program. So we want to know what we could do better, what we need to continue to do for you, and if there's any other education that you'd like to see from us that you're not seeing that we have available. You can throw that all into that. And I appreciate hearing from all of you. We do look at those. They're super important to us. You're going to have a couple of different ways to do that. I've asked Aline to throw a link in the chat. You are also going to get a redirect when you leave this session. It looks like what you see here where it's titled external site. That is not spam or malicious. It's just letting you know you're leaving our software and going into that Qualtrics software. And again, I want to thank you for your time in providing us with a little bit of feedback. It's very helpful to what we do. So with that, that is going to end our session for today. On behalf of myself, Aline, Shakur, and everybody on the Provider Outreach and Education team, I want to thank you all for taking the time to attend today. We are all super busy, and I know this hour can be hard to carve out, so I hope you found this beneficial and useful. As I said in the beginning, the recording is going to be posted, and training materials will be available with that. So if there's someone that might find this useful, feel free to share that. So that, again, will end our session for today. You may now disconnect. Have a great day.